Thank you, Dr. McMahon, and thanks to the course directors for allowing me to talk about something that's a passion of mine, how we take care of ourselves, and maybe equally importantly, how we take care of each other. I have no disclosures to make, and I want to thank my colleague Tom Reek, who will be speaking soon, for some of the help, much of the help we do in the Healthy Living program, where we have a CME course for physicians. Well, when you're at Mayo, you try to tie your specialty to the founders, and it wasn't hard from a preventive standpoint. You can see that Dr. Will Mayo, one of the founders, said the aim of medicine is to prevent disease and prolong life, and the ideal of medicine is to eliminate the need of a physician. Don't know how well we've been doing on that one so far. And his brother, Dr. Charles Mayo, said the object of all health education is to change the conduct of individual men, women, and children by teaching them to care for their bodies well. And that's really true for our patients and also for us. Well, just a little background on how I got into caring for physicians, having an interest in physicians. If you live in Rochester, Minnesota, and you practice medicine, you will see physicians. We have more than 4,000 physicians and scientists in virtually every medical specialty. And in a town of 100,000 or so, they make up a significant chunk of the population. Preventive medicine, which is the specialty that I'm interested in, has been around at Mayo Clinic since 1962. And in our division, we practice prevention, occupational medicine, and aerospace medicine. For that occupational piece, the population that I'm interested in is physicians. The aerospace piece takes care of pilots, and it's interesting the parallels between pilots and physicians as people who have safety-sensitive jobs and their healthcare needs. Well, I want to step back in the beginning here and look at the big picture of preventive medicine and health in general. And you'll see that the slide says for individuals and populations. And so as we go through it, you can be thinking about your patients or your patient panel and also about yourself. So we can fit everybody that's alive on this spectrum, ranging from the pink of health or optimal health to being moribund or teetering on the edge of death. But most of us fit in between, and most of us are not at those extremes and have some measures that we can do to make our health better or medical conditions that we can pay attention to. If you look at the impact of these and the distribution of these, and you look at that far left side of the graph, those who are in optimal health, it really only represents about 1% to 3% of the population. And my experience has been that that's true of physicians as well. And if you go up to about the healthier 70% of the population, they account for about 30% of the costs for healthcare in the United States, and that last 30% accounts for 70% of the healthcare. So that's a fairly well-known and understood concept. We spend a lot of money and resource at the end of life. Maybe we should push a little bit more of that resource to the left on the graph toward preventing disease and staying healthier.